Welcome to the Purely Podcast. I'm your host, Nika Laurie. Marina Piña, welcome to the show. I'm so excited to have you here today.
Thank you, Nika. Thank you for having me today. I am beyond excited to be here with you.
I'm so excited to have you here too. I know we've been friends for a while. We work together in different capacities as well, but I was super excited to bring you on the show because I think you have such an incredible story. It's an inspiring story. It's a very timely in the moment story for everything that's going on, but I think it, transcends the craziness of politics as well because it's just such a unique and interesting and inspiring story that you have. So we're going to dive into that. I want to ask you a little bit about what you do now, and then we'll go into your childhood. Just tell me a little bit about yourself so the audience knows who you are.
Yeah, thank you so much for that. Well, I currently serve in a statewide leadership role in this beautiful state of New Mexico as the communications and marketing director for the New Mexico Healthcare Authority. And for your audience, the Healthcare Authority here in New Mexico serves over 50% of the population. And we do have a large agency, over 2,000 staff members. And I am very lucky to lead the communications and marketing initiatives for really reaching out to New Mexico's diverse communities and also making sure that we have that relationship with all staff who do amazing work in our different departments and divisions, really to help New Mexicans. Because of the programs that we administer, we do serve a population with usually is limited income. We do oversee the programs of Medicaid, which is the federal and state health coverage program for people with limited income, people with disabilities, and then also programs like food assistance through SNAP, cash assistance, utility assistance. So we are really that lifeline for many New Mexicans and that safety net. And also really our work, it's so much around providing more access to healthcare across the state, right? Especially in rural, frontier, and tribal communities. In New Mexico, we have many different pueblos, tribes, and nations for our indigenous population, and that is definitely front and center in the work that we do. So I am very lucky every day to come to work and lead and drive that strategy of communications and how we connect with people. That's my current role, but it's been a journey to get here, and I feel like I'm just getting started.
Absolutely. I mean, what an awesome position to have that kind of impact on the lives of literally, more than 1 million people across the state here and, different groups that are working on different things. You get to interact with them all the time and share ideas and resources and support for them. So it's a really incredible role. I really admire you and the work that you're doing in that position. So thank you for everything that you do. But you mentioned it's been a journey. I want to get back to the start of that journey and really tell your story. Can you share? So you grew up in Chihuahua, Mexico. Can you tell me a little bit, what was your childhood like? What was, how is it different than being here in the United States? And what was your process or your journey of coming to the U.S.?
Yes, so I am an immigrant to New Mexico, and just like many immigrants here in New Mexico, we do think of ourselves as adoptive children of adoptive New Mexicans, right?
Absolutely.
Like I am an adoptive daughter of New Mexico. I consider myself a New Mexican. And then I also have that bicultural, binational, experience.
Mm-hmm.
I was born and raised in Chihuahua, Mexico. Chihuahua is the biggest state in in Mexico, and it's a beautiful state. And I had, just a normal, regular childhood. I really grew up with a family all around me, with that sense of community, with really knowing who your neighbor is, asking for help, really building the community. And then also facing challenges, right? Facing challenges, especially, with our social economic status. I also grew up with a father who always would come to the US, like back and forth. He would work here in the US as a migrant worker in temporary jobs in agriculture. And then when the season was over, he would go back to Mexico, right? So he would be here for seasons, for months at a time, and then go back with us. So that was really, as a child, it was always very exciting to wait for that, and like the dolls that he would come with, and the toys and the candies and the clothes, and like all of that excitement
Yeah.
that I really had as as a child, waiting for my dad, and from coming from the US with all these gifts. um, as an adult, it's going back into that experience. It's bittersweet because it's a different um, understanding of what that entailed. But back then, as a child, it was really exciting. And then, before my dad, my grandfather, my dad's dad, he was part of the Bracero program, right? So he would also come as part of the Bracero program, work for seasons, and then go back. So really, even though until the age of 15, I was in Mexico, that's when my mother decided to join my father and migrate to the U.S. Um, the United States experience, right? Like that American experience, has always been ingrained in my life, just as
Yeah.
many families in Mexico.
Yeah.
And so we decided to, or my mother decided to join my dad. Things started to get more challenging economically. So she decided to join him to really join the workforce and come here and work. So she brought us with her, as myself, my younger brother, and we were very lucky to land in the land of enchantment. I am biased, of course,
Yeah.
but we migrated from eastern Chihuahua to eastern New Mexico. So, when I was 15, that's when we landed in Portales, New Mexico, which is the southeastern part of the state, for those who may not be in the state. And then from there, we integrated into, the schools, the community. It wasn't easy. It's definitely a cultural shock. And then what I want to make sure that your audience understands is that every immigrant experience is different, right?
Yeah.
Like my experience is not the same as any of the many million of immigrant stories that we have around the country. Um, some more challenging, some less, but there's still that you know uh, that journey of mixed feelings, bittersweet, leaving what you know, leaving your home country, leaving your extended family behind, the food, the neighborhoods, the schools, your friends, and coming and into something completely different.
Yeah.
And then also the language barrier, and trying to navigate systems that are very different to where you come from.
hmm What was that like when you first came here in Portales? especially with the language barrier, how did you go through the process of navigating, high school and making friends and learning English and, um, you know, uh, finding your way here in the US? What did that look like for you the first few years?
I think for me, as a teenager, this is teenager Marina speaking. Uh, Now I know better, but
Yeah.
as a teenager, I really didn't want to make any friends. I
Hmm.
was like, I'm going to be here only for 2 years. I'm going to learn English and then I'm going to go back to college in Mexico because
Hmm.
that was my original plan, right? Little did I know that 20 years later, I was
Still, it's land of entrapment.
the land of entrapment. Exactly. That's what I tell people. It's like, you
Once
know,
once you're
you
here, you
plan that you're
don't
going to be
leave.
here for 6 months, 2 years, and then you just stay.
Yeah.
So,
Yeah.
yeah. So I was hesitant to really integrating, into building in that community um, and having new friends. Uh, but then, of course, it was really difficult, right? So
Mhm.
I started meeting people, meeting, high school kids, mainly also like from similar backgrounds, immigrant, if not themselves, their parents, um, and really hanging out with kids who spoke my home language, Spanish. And my high school experience was really pretty much because I only had 2 years of high school here.
Mhm.
Um, I really got to hang out with, Mexican American, Mexican kids who some of them are still my friends,
Yeah.
so we have that in common and we continued our friendships even though we all have gone different paths. And, but what I really needed to do for myself is to learn English quick
Yeah.
because I was going to go back. And, and in Mexico, if you know the language, if you know English, that really helps. It could help your career, right? So
Mhm.
that was my goal. Um, so I was, when you come from a different country without knowing English, in the end, you are in the school system. They make you take the ESL classes, right? The English
Mhm.
as a second language. But that I I needed to challenge myself more, so I took that class, and then I also requested to take the regular English classes at at junior high level, um, which really accelerated my
Mhm.
learning. So it was tough, but I was very goal oriented.
Yeah.
And I was here with a mission. Like, I need to learn English. I'm like, I need to get this done. I don't care, but I only have 2 years. Um, and then through those 2 years, my experience as an immigrant and the experience of my family was not only as um, you know, as an immigrant family who is coming to the US and trying to make our lives better. But
Mhm.
then also 6 months into being here in this country, we found the immigrants' rights movement.
Mhm.
So my mom, my younger brother, and myself, we became part of the immigrants' rights movement in New
Yeah.
Mexico. So I had that experience since the very beginning of not only have a regular life, if you will, as an immigrant family, but we became activists, we
Yeah.
became community organizers, we advocated for human rights that included the immigrant community. And we're being able to build that movement and give space to new families, new individuals to take the lead and continue that work.
I want to ask you more about that, but before we get into your advocacy work, I want to know what was your experience going through, so you became a DACA child, and you've been able to go through the process and become an American citizen. What did that look like? And maybe how did the advocacy play a role alongside that? Did that help you navigate that system more, or what was that experience over those years?
Thank you for asking that. I got lucky
Mm-hmm.
because I barely made it into qualifying for DACA,
Yeah.
right? The different requirements that they have, the timing that I came, the age that I had, the process that I went through. I got really lucky, and
Yeah.
I don't want to take that for granted, right? That many people still did not qualify, um, and we really need a system that values everybody in
Absolutely.
the
Yeah.
immigrant community and beyond, right? But
Yeah.
in this case, so because of me qualifying, by the time that the Obama administration and the immigrant right movement pushed for it, right?
Mm-hmm.
It
Mm-hmm.
wasn't like hey, we'll give you this. And like the communities,
The
entire
community
communities
fought for it. Yeah.
fought
And
for it.
I mean,
Correct.
and it was with, teeth being pulled that there was some leeway given. Yeah.
Yeah. So, really want to highlight that. Um, so when we learned when the announcement came out, I was already working in the immigrants' rights organizations movement, really pushing for immigration reform, something bigger.
Mm-hmm.
And the announcement came. It was so much joy and excitement, and still felt really surreal.
Mm-hmm.
Um, but I think mainly the feeling, if I go back to those moments, it's of joy of like, wow, we made it. And
Yeah.
I'll tell you that when I received, and I'll go back to how I got there, but when I received my DACA card in the
Mm-hmm.
mail and I showed it to my parents, they cried so much.
Yeah. I was going to say, did you cry? Because I would have cried. Yeah. I want to cry for you now. I wasn't even there for
I
then.
would
Like,
cry just going back to that moment. They cried, got even more excited, my
yeah.
parents, at that moment than when I became a US citizen.
Oh my gosh.
Like the US citizen part, I think not that they were not happy about it,
Yeah.
but they're like, well, it's more of a given. She's been on the path. I think they truly got more excited when I received my DACA. So
Well, I think also it gives them a little bit of sense of security for their child too. Uh it's silly that it's, just a card, it's a piece of paper basically, right? But it gives you access to so many other things that you wouldn't have had access to outside of that. And I think as a parent looking at your child, all you want is success and happiness and safety for your child. And so I can see them, you know, looking at that moment as almost like a sigh of relief in a weird way.
exactly. So I the irony of it, right? Because I
Mm-hmm.
was so embedded in the movement, I was an activist, or very active in those years of my life, and I was in the front lines, basically,
Mm-hmm.
here in New Mexico of that movement, along with many others. And the irony is that I did not apply for DACA until 1 year later that it was into effect.
Mm-hmm.
Because I don't know, like I felt like, okay, like I give know your rights presentation. I know my rights. I know what I can do.
Mm-hmm.
So I think it was more of the like living, taking care of others before you take care of yourself,
Yeah.
and then a movement lawyer. Uh, they helped me. They helped me go through the process. And I think that's also part of, like the being involved in people willing to help.
Mm-hmm.
Um, and also like being able to help, right?
Yeah. Yeah.
Um, so I had all these angels that, were in my life in the right time, in the right moment, um, that came because of the work that I was doing, because of the connections and building the relationships. Like community organizing is very relational,
Yeah.
like building those personal relationships, building transformational relationship, not transactional. And that continues to be part of my values, right? Um, Building those communities that are really gonna sustain you
Mm-hmm.
uh, during hard times and during good times too.
Yeah, definitely. I was going to ask you, what does you said, I was on the front line of this advocacy work. What does the front line, I'm doing air quotes for the people listening, what does that look like? I fully understand the building those community relationships, and they're, it's like building lasting friendships. It's really that connection. But what else does it look like? What was the fight? What was the process?
Yes, so I became an activist when I was 16,
Mm-hmm.
and it was really on the front lines until 4 years or so ago.
Mm-hmm.
So 32, I am totally disclosing my age now, but that's fine. Um, so for over 15 years or
Mm-hmm.
so, almost 20 years, I um, I was doing along with community members or organizing our
Yeah.
people, right? So here in New Mexico, that meant for me traveling all over the state, building community organizing local groups. And these groups were mainly immigrant women and
Mm-hmm.
their families,
Mm-hmm.
um, with allies as well, right? We need those allies, those key leaders in the community that are able to work with us
Absolutely.
to get to a goal. But our groups were mainly immigrant women and their families and their kiddos who, grew up in the movement just the way that I did, just the way my younger brother did. And really, that meant going to city council meetings,
Mm-hmm.
trying to pass resolutions in support of driver's licenses for immigrants, trying to pass resolutions in support of the Dream Act, right? That which
Yeah.
is pretty much into for those who many of them got DACA, but we still need more than a work permit. Um, it meant meeting with law enforcement at the
Mm-hmm.
local level and making sure they are not collaborating with immigration, making sure the county jails are not collaborating with immigration.
Mm-hmm.
And this was not just meeting, but also keeping them accountable, uh, trying to pass local laws that would not allow them to do so, gaining champions, right? And by champions, I mean city councilors who would champion our advocacy, our issue-based
Right.
campaigns. It meant having protests
Yeah.
in March,
Yeah.
you know, and also like meeting in community with food and celebrating the wins that we have, coming to the state capitol and lobbying our legislators, being really active. And that's something that I really want to give credit to my mother
Mm-hmm.
because she taught me. She doesn't speak English.
Mm-hmm.
Um, and she taught me that it doesn't matter if you don't speak, the language, in this case, English. You still can advocate for yourself. You
Yeah.
still can go out there and try to keep them accountable. You can still fight for human rights and you can make things happen, right? And that I learned definitely from my mother. Like, do not stay quiet just because you don't speak the language or because we have certain barriers or certain adversities.
Absolutely. I think, just the basics of treating humans with decency and fighting for basic human rights that
Yeah,
crosses all languages. That's, it
yeah,
shouldn't be a English only, process, right? And so, having that compassion and um willingness to care for other humans, even if you didn't grow up in the same communities together, is just basic. It shouldn't be a cultural thing.
exactly. And I
Yeah.
also think that that actually helped our mental health.
Mm-hmm.
It's like being part, knowing that you can do something,
Yeah.
right?
Yeah.
Knowing that we have people out and we can do something together.
Yeah. Absolutely.
It's so healing.
What do you wish people knew about either your experience as an immigrant coming here or the fight that people aren't often aware of or don't discuss? What is something just that you wish people knew more about?
That is a good question.
Putting you on the spot. Sorry.
I think, well, immigrant families, individuals, community members, um, we do not live in a vacuum, right?
Mm-hmm.
Like being an immigrant is not doesn't completely define us, right? We are
Right.
part of communities. We are part of the local church. We take our kids to schools. We're part of our workplaces. We pay taxes.
Mm-hmm.
Um, we create safer communities, and that is data supports that.
Yeah.
Um, we are, you know, bigger than our identity as
Yeah.
immigrants. And then also at the same time, for me at least, I cannot speak for the entire immigrant community, but like that has been pretty much the work, my work, or my professional work, if you will. It's driven by my personal values. And
Mm-hmm.
my personal values are pretty much aligned with my identity as an immigrant.
Mm-hmm.
Um, So, and then also we want just what any other regular family in the country wants, better opportunities, safer communities, healthy, um, um, with, to be in good health
Mm-hmm.
and to work and contribute, to have access to rest
Yeah.
and just a moment of rest and really bettering our communities and being very active.
Yeah.
We're not passive at all in our communities. We're very active. And then the last thing I would say is that not all, but many people may see us as liabilities, and we are freaking assets
Mm-hmm.
to our communities.
Yeah. The just the word liability hit me hard that you said that, because I can't imagine thinking of somebody who's gone through the process of leaving their home and their country and their family and their cultural connections behind for opportunity, to be that brave and to go through that much turmoil to come here and be considered a liability. Like, that's just mind-boggling to me. I think, you know the people that I've met that have gone through similar experiences as you have come and heavily contributed to the community. They are hard workers. They are kind, compassionate community members. They pay their taxes. They get involved in the community. They support each other. They create their own communities to help each other thrive. Like, it's so rare that you hear about, you know, you hear about the scare stories all the time of the immigrant came and killed the girl, and we've arrested him and left. I mean, that happens anywhere. A white man is just as likely to do that as a Mexican man that came and immigrated here. And so I don't know, just the word liability hits me really hard because it makes me angry and sad at the same time. Yeah.
And that we are not victims, right?
Hmm.
Don't victimize our community.
Yeah.
Work with the community. Uh, but we have amazing, great, brilliant people. And we're just very lucky to be part of the immigrant community. That's
Hmm.
how I feel.
Absolutely. Yeah. I want to kind of change directions here a little bit and ask you about your work in healthcare and your own personal experiences with navigating the healthcare system. I know you and I really connected talking about how difficult it is for people to navigate the healthcare system, especially as we work together to support the mission that the New Mexico Healthcare Authority is working on, the different marketing campaigns and programs that they're offering to the people of New Mexico. But I want to hear about your personal experience of trying to navigate that system and how you've learned from that system. Can you share a little bit about your story?
Yes. So first, I, because my family, except my father, he was a legal permanent resident,
Hmm.
were undocumented. We didn't have access to health insurance, right? So we would
Yeah.
go to the local clinic, but not so much as regular checkups, but just when we were truly sick.
Right.
I
Yeah.
remember at 16, I got smallpox.
Oh my
Horrible
goodness.
time to get smallpox. It was
Wow.
the most horrible experience.
Yeah.
Um, that's what got me to the local clinic, uninsured and probably costing a lot of money to
Yeah.
the clinic. If we had access to health insurance, just as any other things that we might be able to access, we would get them, right?
Hmm.
We want to comply, which is part of being in the community and have that um, insurance, right?
Yeah.
So that's just a little bit like there's also a miss information that as an undocumented immigrant you have access to safety net programs or social programs. Not really.
Hmm.
That is not the case, right? We live in many mixed status family. My own family was mixed status, and you may have undocumented parents with U.S. citizen children,
Hmm.
and because they are U.S. citizen children, and rightly so, they qualify. They may qualify for it. I also more recently experienced navigating the health system when my father in 2022 was diagnosed with stomach cancer.
I'm really sorry.
And we went through 1 year and a half of his process. Um, he went through several chemos before surgery, and then surgery, and then chemo after surgery. Um, and he was going to his checkups. And then in one of the last checkups that he had, the cancer metastasized
Hmm.
and came back, and it was really at a stage 4 where nothing really could be done.
Yeah.
So from the time where he was giving that diagnosis to the time when he passed away in 2023, it was a 3-week period, right?
Yeah.
And very hard. We also had never experienced what an end of life process was. Palliative care is
Hmm.
something that I mentioned with his doctors, where this is vocabulary that we do not have, and
I
it
was
can be
going to
the language
specifically
barrier.
ask you about what is the language barrier like when navigating that kind of just a devastating situation.
Yeah, we definitely need from our experience absolutely more bilingual, in our case, Spanish speakers, healthcare workforce. Um, they had like this machines that would translate for you, very transactional, very cold.
Mm-hmm.
uh, we really need to continue finding ways to humanize the healthcare experience for communities that are disenfranchised, marginalized, underserved, under-resourced, and then for everybody, right? When we make it better for the lowest hanging fruit, we make it better for everybody,
Yeah.
right?
Yeah.
So that was a really hard process. I am very surprised that I'm not crying right
I know.
now
I'm
every
sorry. I
time
know
I
it's
think
a
about
hard,
that.
hard. Yeah.
He was an amazing human being. He fought until the last minute. He kept saying, which I feel like I need to tattoo this to myself, like this phrase in Spanish, hasta que tope,
Mm-hmm.
right? Like until the end. We fight until the end. And we did. We did, but we had to. I am the most fluent bilingual person in my family of origin. Now I have my own family, my own kiddo, my husband, who
Yeah.
I love and support me through all of this. But in my family of origin, I am, the only fluent, bilingual, who has more experience, perhaps navigating different systems. But then at the same time, I want to make sure to say that again, like the fact that my mother doesn't speak English, didn't stop her
Mm-hmm.
from navigating the system. I mean, I don't know if I can say certain words here, but
Go for it.
uh,
Yeah.
I mean, she's a pretty badass human being, right?
Yeah.
So definitely, she took the lead. I was there, as a supportive point, but navigating that was very difficult. But even before my dad got the diagnosis, I would say that getting to that point uh, was continues to be a failure in the healthcare system, where he, as a Mexican, 60 in his 60s, he died when he was 66,
Mm-hmm.
very young,
Way too young. Yeah.
and having a full-time job, having health insurance, being a legal permanent resident in this country, um, for so many factors, didn't have regular checkups. The pandemic really exacerbated that with, like delays in appointments.
Yeah.
So that was a factor. And, skipping one day of work for him would mean having your paycheck, come short.
Yeah.
So, why would I miss one day to go to check, have this checkup done
Right.
if I'm feeling okay,
Yeah.
right? So I sometimes I debated whether to say this or not with Unica, but I do strongly feel like my father, in the bigger sense, didn't die of cancer. He died due to poverty, right? Due to systems that make it more difficult for people who are in poverty
Yeah.
um,
Ugh, you're gonna make me
to
cry
do
too.
so.
Yeah.
I didn't know I was gonna need clinics,
Yeah.
but
I
yeah,
I hear you and I agree. And it's not okay. Um, I'm not sure what I can say, in this situation, but it's not okay. And I agree. And
yeah,
we got to fight to change it for sure.
yeah.
Yeah.
And then at the same time, again, going back to the not victimizing my own experience and my family's experience, we fought until the end.
Mm-hmm.
We filed complaints when we had to file complaints with the healthcare facility. 95% of the time they were great, but we had to be there
Yeah.
advocating for our dad. He did his best.
Yeah.
He was a warrior. He fought until the end, and he did it with dignity. And out of everything, what I really, keep in my heart is that he um, had or he died with dignity.
Mm-hmm.
The
Absolutely.
process, the palliative care, when my mother finally accepted that, um, the care of the nurses, um, besides the one experience that wasn't particularly pleasant, but we were able to handle it because we advocated for it. And like my family is so brave.
Yeah.
And that is just one story, right?
Yeah.
Of one immigrant family. Like we have many around the country.
I'm gonna have to bring you back for other stories, and we'll bring others in as well to share their stories because I think it's so so important. But I want to be courteous and conscious of your time. I have one last question for you. Before I ask you that last question, I just want to commend you for the work that you're currently doing to make the system better for people like yourselves, all people across the state, and really the ripple effect that that has for people across the entire country as well. So, thank you for the work you're doing. Thank you for the work that you've done in the past, advocating for immigrants and your community to have a better life here. And your story is just inspiring. So, thank you for the work you're doing.
I received that. I
Yeah.
received that. Thank you.
Absolutely. So, my last question for you, Marina, is if the world was listening and you could share one simple but powerful message with them, what would it be?
Take the first step, one step at a time, for whatever it's in your heart. If that's a cause, if that's bettering your family, your community, um, take action.
Absolutely. I love that. And thank you, Marina. Thank you so much for coming on the show today. I'm so grateful to have you here. I really appreciate it.
Thank you so much. I appreciate your time and your listeners.
Absolutely.